Well, during Stroke Awareness Month, we want to tell you about a treatment that is changing the lives of stroke survivors. It not only improves their hand functions, it's said to be improving their overall quality of life. Nicole Goldstein, occupational therapist from Tampa General Hospital, is here along with Blanton Garnett, a stroke survivor, to tell us about this new device called Vivistim. So welcome to both of you to the show. Yes. So I want to learn more about this device. Tell me exactly what it is and how it works.
Sure. So Vivistim is an FDA-approved treatment option for chronic stroke patients such as Blanton. It uses vagus nerve stimulation, and we pair that with intensive occupational or physical therapy. And when we pair those two together, it helps drive neuroplasticity, which helps form those reconnections in the brain that have been damaged by a stroke. And so the patients perform intensive therapy for 6 weeks. It's 3 times a week for 90 minutes. So we get to know each other well. But it's shown to improve the outcomes 2 to 3 times compared to traditional therapy alone. Wow. So great results so far, and Blanton's a great example of that.
Yeah, and so this is something, Blanton, that it's underneath your skin. There's a little device underneath your skin.
That's right.
Okay, and she can control it, and then you have a way to control it as well?
Mm-hmm.
Yes.
Okay.
So it's an implant similar to a pacemaker. It's about the size of an AirPods case. It's right under the left chest wall. And then they connect that implant with a lead to the left vagus nerve. And that left vagus nerve is what's shown to really drive those neuroplastic changes in the brain. And so during our therapy, we'll have a laptop, and we use this remote here. When I push the remote, it stimulates the device, and we pair that with task-specific training. And then at home, he'll use this magnet, and the magnet will activate the device at home. So he'll swipe over the device, and he can do that for an additional 4 hours each day.
Okay.
On top of the therapy that we're doing in the clinic.
Yeah. Okay, so I want to hear from you. What have you noticed? What kind of improvement have you noticed since you started working with this device?
For me, it's been very dramatic because I can actually use my arm and my hand again. And before I had Vivistim, it was just basically an appendage sitting next to me. So it's really great.
Yeah, and so you suffered a stroke when?
September 15th of 2023.
Wow, so I know it's such a long process. What were your thoughts when you first heard about this device?
We worked together about 4 months when Nicole brought it up, and I said, can we get it done next week?
He was very motivated, and that's a big component of somebody who makes a good candidate is, number one, they need to have an ischemic stroke, and they need to be in that chronic phase, so at least 6 months post-stroke, and they need to be very motivated, which Blanton has been absolutely a great patient, very motivated, always willing to try new things and be open to new therapies.
I'm
so that's
an
a big
impatient
component.
patient.
Impatient
I
patient. I like
want
that.
it to happen sooner rather than later.
Yeah.
So.
Well, you had a reason that you were patient because you wanted to get back on the greens, right? You wanted to
right.
get back to playing golf.
Yep.
And since you've been using this device, you've been able to do that?
I haven't been able to play golf yet, but I've been able to take some lessons and hit balls. And I'm going to be playing golf next week, so try it out.
That's amazing. You have a putter with you
Yes.
today? I don't know. Did you want to do a little demonstration to show what we could do?
Absolutely.
Okay. All right. How does this work here?
So in the clinic, I'll have this device that's used to stimulate the implant, connect to the implant. And so as he performs each intentional movement, I'm going to stimulate.
Wow.
Perfect.
Well, right in the hole.
Yeah. Does it improve with your shot, though? That's the thing, right?
I'm not sure. We'll know next week.
We'll know next week. Now, is there any pain involved with this device?
No, it's a very mild pulse that's being sent to that nerve, so it's a very low level of stimulation. Most patients don't feel it, or maybe describe it as like a tickle in the throat.
Yeah, that's really what it is. It can be kind of difficult when I swipe the magnet. It's a little difficult to talk, so I don't talk much during my therapy.
Interesting.
And so each patient has a different level of sensitivity, and we can adjust that as well. But based on the research, we want to have an optimal level of stimulation that's shown to really drive those changes in the brain.
Yeah, and how long will this device be with him? Is it forever? Is it just during treatment?
Yeah, so typically we change the battery around 5 to 7 years, but the device he can keep forever. As far as for some stroke patients, there is more, they are prone to maybe potentially another stroke. And so we advise that they keep the implant in there. God forbid there were another stroke, that we could start the therapy right away.
Yeah, well, I know TGH is very excited to have this device. Can you tell me a little bit more about the stroke program there?
Yeah, so we are a comprehensive stroke center. We have an excellent team of therapists who are very skilled. We're trained in neurorehabilitation. So we have a great center. We have a few outpatient centers that offer this technology. We're always striving for innovation and world-class care, so we're very excited to be a part of this.
Yeah.
And I was a patient at the inpatient rehab for 7 weeks. It was fantastic.
Yeah.
When I got there, I couldn't move my right side at all.
At all. And now look at you.
Yes.
Getting ready to play golf next week. All right,
Yeah.
you're going to have to let us know how you do.
I sure will.
Okay, well, good luck. And
Thank
you
you.
for coming on and for sharing
so much.
this with us.
Thank you.
And if you want to learn more, you can head to the website that you see right there, vivistim.com.